NeedyMeds users and friends. My name is Carla. Thank you so much for joining me today. I'm the Director of Education and Partnerships at NeedyMeds, and today I'm going to teach you how to find healthcare cost savings resources on NeedyMeds.org. Before we get started, I wanted to go over a few tips so you can get the most out of today's presentation. You can feel free to ask questions at any time by typing them into the questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. If I don't get a chance to answer your question, I will follow up with you via email. Of course, I will provide my contact information at the end. This webinar is being recorded and will be available for viewing on the NeedyMeds YouTube channel, which I will direct you to during our presentation. And a copy of today's PowerPoint presentation can be found in the handout section of your control panel. So let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit founded just over 2 decades ago by retired family physician Dr. Rich Sagel, who is still our president. On your screen is our official wording of our mission statement, how we achieve our mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. We do that free and anonymously through our website, NeedyMeds.org, and our helpline, 1-800-503-6897. And one of the most popular and effective ways we do this is with our large listing of prescription assistance programs. Prescription assistance programs are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. Of course, not every drug will have a prescription assistance program. When a program is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved by providing a prescription, signing the application, and submitting the documentation. So, how do I find prescription assistance programs and other healthcare cost savings resources on the NeedyMeds website? Well, bear with me while I transition out of the PowerPoint and onto our live site so I can demonstrate. Just bear with me one moment. So as you'll notice, as soon as the NeedyMeds website is open, that our website is full of information. We're going to spend today's webinar checking out the cost savings resources under this patient savings tab. So what I'm going to do is encourage you that when you have more time to browse the other destinations on the website, in particular, the other destinations on the navigation bar. But a few things I want to point out right now. I mentioned just a moment ago that this webinar is being recorded and will be available for viewing on our YouTube channel. And you can find the icon, which is a link to our YouTube channel on the top right-hand side of our homepage with the other social media icons. It's the third one from the left. And I do hope that you subscribe so you can stay up to date on all of our latest videos and webinars. Also, if you don't know, NeedyMeds now hosts Be MedWise, which you can find on the left-hand side of our homepage. Be MedWise is full of accurate and up-to-date patient information and education, specifically a great resource for medication safety. In the beginning of the year, we updated our monthly e-newsletter featuring health-related articles and valuable resources for advocates and patients. It's been renamed Vitals, and you can find that under the Advocates tab where it says NeedyMeds Monthly Newsletter. And we hope you add your name to the list of more than 12,000 people that are already receiving this monthly newsletter. Okay, so let's get back to prescription assistance programs. Now, you can always begin to search for a cost savings program by typing the name of the drug in the drug search bar right here on the top left where my cursor is blinking. If you are specifically looking for a prescription assistance program, let your mouse hover over that patient savings tab, and the top left-hand box is specifically dedicated to prescription assistance. And as you can see, there are a number of ways you can search. You can search by probably the least common company name or program name, but you can also search to see if a prescription assistance program is available by the brand name of that drug. So let's say we're looking for help affording a brand name drug called Lipitor. I'll go ahead and click on that brand name drug hyperlink. And the first thing that happens is a bunch of icons pop up. What these icons do is they show you what type of information or cost savings program is available for that drug. Is there a prescription assistance program or a coupon available? Is there more information available about the drug with support pages or drug videos? We also just added this icon, a blue circle with an italic letter I. And I'm sure you've seen an I icon on other sites, and it pretty much always means more information. In this case, it refers to more information about the medicine, and it will take you directly to a drugs.com page with additional details about the drug or product. As I scroll down, you'll also notice the A to Z index. Many of our larger categories will have this to make your search easy. So, as I said, we're looking for help affording Lipitor. I'll choose the letter L in the A to Z index, and then I'll scroll down the long list of alphabetized medications. If you see the medication you're looking for listed more than once, be sure to click on every hyperlink to make sure you're not missing any cost savings program or information. This top left icon indicates that there is at least one prescription assistance program available. And as you can see, there's also other information about this drug. There are support pages. There is that I icon, which will take you to drugs.com so you can learn more about Lipitor. And under this hyperlink, there is a coupon available. So as I said, this icon on the top left indicates that there is at least one prescription assistance program available, and that's a hyperlink. So I'm going to go ahead and click that. And right at the top, I can tell that there's currently 3 programs available, and I can see that because right in this blue bar it says program 1 of 3. If there is more than one program, like in this case, then the ones that offer the most assistance are listed at the top, and the ones that offer less assistance are listed at the bottom and then alphabetically. So I'm going to make the screen a little bit smaller. Don't worry about reading the text just yet, because I wanted you to get a snapshot of all the information that is available for this prescription assistance program. And they're all set up the same way. So let's talk about what's on your screen right now. At the top, you'll always find the name of the supporting organization and their contact information. Now, that contact information is important because you're going to want to be sure to direct all questions about the program to that contact information provided as opposed to NeedyMeds. Next is the application section, where you'll pretty much always be able to find a hyperlink to the application itself. You'll also see right beneath that the eligibility requirements section. Now, as I had said in the beginning, eligibility will vary from program to program, but is almost always based on 3 factors: insurance coverage, income, and residency. So let's talk really briefly about those 3 eligibility requirements. One quick thing I just did want to mention about insurance status. Don't make the assumption that if you or the person you're attempting to help, if you have health insurance or drug coverage, that you will not be eligible. That's not always the case. Certainly, oftentimes, prescription assistance programs are available for people that don't have insurance, but as you can see here, that's not always the case. Now, as far as income goes, although, again, it will vary from program to program, it is almost always based on a certain multiple of the federal poverty level. And so that you can calculate what that is, we put a convenient federal poverty level income calculator right here. And I'm going to click on that so you can see how easy it is to use. Let's say we have an individual that earns an annual salary of $85,000. You'll notice I only typed in the digits. Don't type in periods, commas, or dollar signs. Again, this individual's salary is $85,000 a year, And let's say this individual is supporting a family of 3. That's all the information you would need. You hit calculate, and the yearly income indicates that this individual falls at 398% of the federal poverty level guidelines. Now, when I return to the eligibility requirements list, this individual clearly qualifies, which is great. But what happens if this individual found himself just above the federal poverty guidelines at, let's say, 405 or 410%? Well, when that happens, we recommend that you apply anyway and then ask the program to make what's called an economic hardship exception. At that point, if you are still denied, you can always appeal. So let's talk about residency. Don't assume that if you are working with a population that is undocumented, that they will automatically not be eligible. Be sure to check out residency requirements, where we will provide the detailed information for each program. And oftentimes you'll see this, must reside in the U.S., and that means just that the person needs to be living or being treated by a doctor or healthcare professional in this country. And one thing I do want to stress is don't hesitate to call the program directly. They always do provide with their contact information a phone number. So don't hesitate to reach out and give them a call if you have any questions or concerns. Next, you will find the application section. This will let you know details such as how the doctor needs to be involved and how long it will take you to get a decision. And that's important because you never want to put yourself, a loved one, a patient, or a client in a position of missing their meds. The medication section is important because it lets you know where the medications will be mailed to and the details for reapplying. Always be sure to check out the additional information section, because that is where we put other pertinent information that does not fall neatly into the other categories. Now, before we move on completely from prescription assistance programs, I'm going to return to that patient savings tab and click on Help with Prescription Assistance Applications. Now, applications can be complicated. So we've put together a directory that lists nonprofits that help people apply to these programs. And the places we have listed are usually free or will assist you for a very small fee. And you can search for help in your area by zip code or state, and then programs are listed alphabetically by city. Next, returning to that patient savings tab, I'd like to point out the $4 generic discount drug program. This is a directory of all the discount programs available for generic medications at major retailers. Now, although it's called the $4 generic discount drug program, most will range in price, usually from $4 to up to $15 for a 30, 60, or 90-day supply. And as you can see, there are a number of ways to search. You can search broadly by state. You can search by the name of the drug. You can search to see if there's a particular store or pharmacy in your area that participates. But for purposes of this webinar, I'm going to do a broad state search. So let's go ahead and see what's available, for example, in Georgia. So currently, there are 13 stores or pharmacies in Georgia that are participating in the $4 generic discount drug program. And hopefully you'll agree that right now there's a snapshot of all of the pertinent information for those participating stores or pharmacies. The left-hand column will let you know the name of the store and a hyperlink. And as you can see, there are all the large national chains such as Rite Aid and Walgreens, but there's also smaller, more regional pharmacies such as Winn-Dixie or Harvey's. The next column lets you know the program name, and probably most importantly, the column on the far right labeled program lets you know exactly what this program will help you to save. And oftentimes, as I said, the prices range from between $4 to up to $15 for a 60, 90, or 30-day supply. Sometimes it can be a bit more pricey, and sometimes the savings will actually be estimated with a percentage as opposed to a dollar amount. So let's move on. Another really popular destination on the NeedyMeds website under that patient savings tab is our section for free low cost, or sliding scale clinics. We actually updated this section on our website to be more user friendly by breaking it down into 4 categories: medical, dental, mental health, and substance addictions. Now, again, these are all set up the same way. So, for the purposes of this webinar, I'm going to go ahead and click on medical clinics so you can see what this directory looks like. And you can see it is a pretty large category. We have just under 17,000 free, low cost, or sliding scale clinics in this database. And one thing I do want to say is that medical clinics in particular are a good option for those with, certainly for those that are looking for an affordable or convenient doctor. But even if somebody already does have a doctor, it's good to be aware of clinics in your area. First of all, you have no idea what your insurance situation will be like a year from now or 2 years from now. So in case you ever need to find a new doctor, it's good to know what's around. The other thing is being aware of clinics is important because oftentimes they'll have extended hours beyond what a regular doctor's office would. And that's important because sometimes people wind up going to the emergency room, not because it is necessarily a medical emergency, but maybe because they feel they have no other option. So like I said, the medical, dental, substance addiction clinics are all set up the same way. You can search really narrowly to see what's available where near you live. You can search really broadly to see what's available in your state. So I'm going to do a quick zip code search so you can just see what the results will generate. So the results yield in this search that there are currently 8 clinics within 5 miles of the 94974 zip code. And when you scroll down again, there's a snapshot of all the pertinent information. We're going to talk about the far print column in just a moment. But the clinic column lets you know exactly that: the name of the clinic, their contact information, and a website if available. The eligibility section lets you know who can be treated at the clinic and what fee can they expect to incur. And the right-hand column, labeled details, lets you know what services the clinic provides. And it also we will list the hours of operation. Although we pride ourselves on the information being accurate and up to date, we always recommend giving the clinic a call or visiting their website to confirm information that is important to you, a loved one, a patient, or a client, such as what exactly are the fees? Are there other languages spoken by the professionals at that clinic? Whatever details are important to you, we recommend calling or visiting that site. So I mentioned this far left-hand column, the print column. Now, let's say you wanted to provide a loved one, a friend, or a patient with this list of 8 clinics. Then you would choose the print all option, and it'll do just that. It'll print a list of all these 8 clinics. But let's say you want to narrow it down a little bit further, clicking on only the clinics you believe that person would be interested in. Then you would choose the print instead of the print all option. And that will generate and print the list, including only the ones you chose. And again, that's a great tool for healthcare professionals in case they want to provide their alliance with a list of clinics for them to choose from. Now, returning to that patient savings tab, another category I'd like to point out is on the bottom left-hand side, coupons and rebates. And this is where you can find prescriptions and over-the-counter medications or supplies for which there is a coupon, a rebate, a free trial, a free sample. Now, like the other databases, you can search a number of ways. You can search by the name of the drug. You can search by the name of the product. But you can also search by category, which means medical category. So I'm going to go ahead and click on that. And then you'll see there's an alphabetized list of medical categories. Let's go ahead and choose asthma. Now, the great thing is there are all of those icons again. And what these icons do, just like the Prescription Assistance Programs database, is they let you know if there's additional information or cost savings resources available. And then the program for the drug or the product is then listed alphabetically. We used to just have a paragraph explaining what this coupon or cost savings program offered, but we broke it down into bullet points to make it easier to read. You will also always find a link to the manufacturer's offer. And we did put a convenient way to have the NeedyMeds drug discount card printed out, emailed to you, or text. Of course, I'll talk a little bit later on about how the NeedyMeds drug discount card can help you save on your medications. One other thing I do want to point out is you'll notice right on our home page is there's a logo for MedAdvisor. Now, this is a new resource. MedAdvisor is where you can receive free, relevant, diagnosis-related information about clinical trials, treatment options, and research findings. What that means is that you can spend less time searching the internet for information on your medical condition. With MedAdvisor, the only information relevant to your diagnosis will come straight to your inbox. And you simply sign up by clicking this Yes button, and you'll be able to receive articles that are summarized and bottom-lined in easy-to-read English. And of course, it's HIPAA compliant, so your information is secure. And I wanted to be sure to mention that. And you will be able to find a link to MedAdvisor under all of these categories where you can search by diagnosis. We're working on adding that momentarily. So let's get back to that patient savings tab and move on to actually the second greatest source of savings right after prescription assistance programs, which is our diagnosis-based assistance programs right in the center. Now, diagnosis-based assistance programs are different because for the most part, it doesn't include medicine. What it does include instead are other necessary medical expenses. For example, maybe you need help affording medical supplies or durable medical equipment, or something like a wig or house cleaning services or assistive technology. Like the other databases, there's a number of ways you can search. You can search probably least commonly by the name of the program. You can search geographically by state or nationwide. And like the coupons database, you can search by diagnosis. So let's go ahead and click on by diagnosis. And because this category on our website is so large, you'll see the A to Z index again. And I'm going to go ahead and choose D for diabetes. Now, I like to use diabetes as an example since it is not only a common diagnosis in our country, but it's a great example of a diagnosis that requires a lot of expense in addition to medication. Oftentimes, people living with this diagnosis have to purchase things like testing strips, syringes, or sharps, or assistive technology. So because diabetes is a broad category, it's broken up into a bunch of subcategories, but I'm going to go ahead and click on the general hyperlink for diabetes. And as you can see, there are currently 71 diagnosis-based assistance programs for diabetes. You may notice a lot of times I'm saying there are currently X amount of programs. The reason I say that is because we're constantly updating our website. So if you don't find assistance you need, be sure to check back regularly to see if a program has been added. So now let's check out these 71 diagnosis-based assistance programs for diabetes. Like the other databases, now there's a snapshot on your screen of all of the pertinent information. On the left-hand side is the name of the program and a hyperlink. Then you'll find the summary of the program, and the columns you'll be most interested in are the two far right columns, the services that are provided and the areas of service. Now, as you can see, a lot of times diagnosis-based assistance programs offer things like help affording supplies or assistive technology or durable medical equipment, but it does vary greatly. There are others that will help you afford things such as respite care or even help getting a service animal. That far right column, area of the service, you'll notice it keeps saying national. That's because we put all of the national programs first, and then the rest of the programs are listed alphabetically by state. National means that regardless of where you live in our country, you are eligible to apply. And then, as you can see, the rest of the programs are listed alphabetically by state. Now, since we're talking about diabetes, um, which is an example of a diagnosis that requires people to sometimes self inject, I want to point out on the left hand side of our website, safeneedledisposal.org. Safe Needle Disposal is a website that helps people to find out how to responsibly dispose of home generated sharps. Now, as you may know, there are limited options for proper disposals of needles and sharps, and that can lead to dangerous situations for public and workers, causing exposure to a variety of potentially serious diseases. So please do check out safeneedledisposal.org to see how to responsibly dispose of sharps in your area. Okay, so, and I'll take a moment to remind everyone that if you do have any questions, don't hesitate to type them into that question section of your GoToWebinar control panel. Now, since we're on the topic of finding diagnosis-based assistance, in the center section under that Patient Savings tab, right above diagnosis-based assistance, I want to point out diagnosis information pages. These are informational or educational pages dedicated to specific diagnoses. Our goal is to partner with other reputable nonprofits to provide the most comprehensive information about a particular diagnosis. Then, as you can see, the diagnoses are listed alphabetically. I don't want to spend too much time here. I just want to make sure you know about this destination, especially if you, a loved one, or a patient is newly diagnosed. Now, returning to that Patient Savings tab, we also have, bear with me, I want to make this screen a bit smaller. We do have databases or sections on our website dedicated to medical transportation, which is exactly what it sounds like. Oftentimes, getting to and from a doctor or specialized facility can prove a burden. So please don't hesitate to check out the medical transportation section. We also have databases dedicated to retreats, camps, recreational programs, and scholarships. Sorry about that. And for those of you that are in or work with people who are seniors, a great resource is the government programs database section. It includes pretty exhaustive information on programs available in your state, but it does have pretty exhaustive information on Medicare and Medicaid. So be sure to check that out. Now, I'd like to switch back to the PowerPoint so I can talk to you about another important way you can save on your medications and healthcare expenses, which is with the NeedyMeds drug discount card. And before I do that, I want to make sure I put up just a slide of all of the databases that we just covered. So let's talk about the NeedyMeds drug discount card. Drug discount cards are not part of insurance. They are cards. Sometimes they can look like a plastic credit card. They can be on paper, or they can be an app on your phone. And you simply take this card, the drug discount card, to your pharmacy with your prescription and try to save some money. Now, as you know, there are other drug discount cards out there, but the NeedyMeds drug discount card is free and it's anonymous. There is no registration, no enrollment, no residency requirements, and it does not have to be activated. The NeedyMeds drug discount card can be used for prescription medications, for over-the-counter medications and supplies as long as they're written as prescriptions, and even to help save on your pet medications as long as you pick them up at a regular pharmacy. With the NeedyMeds drug discount card, users can save between 0 and up to 80% off of the cash price of prescriptions, over-the-counter medications, and supplies. A few other facts to keep in mind is not every product will be discounted, and discounts will vary from month to month and from pharmacy to pharmacy. The card does get let me say it this way: the NeedyMeds drug discount card will get you a discount 85% of the time it is presented to the pharmacist, and usually that discount is about 50% off of the cash price. So the important question is, who can use this card? And the simple answer is anyone. The only rule is that it can't be combined with insurance. So if you don't have insurance, you can use the card anytime. If you do have insurance, you may choose to use the card, and you may choose to do that, for example, if you find that your medication isn't covered. Maybe you find out that your copayment is too high. Maybe you find out your deductible is too high. Or maybe you find that you're in a coverage gap. The card is ready to use. You simply bring the card with a valid prescription to your pharmacy and save. You can also use the NeedyMeds drug discount card to save 40% off the list price of durable medical equipment. This includes products such as diabetic supplies like needles, testing strips, and meters, splints and braces for your ankle, knee, neck, and back, for example, catheters and incontinence supplies, bath safety options like commodes and grab bars, mobility devices such as canes, crutches, walkers, and wheelchairs, and footwear like inserts, and so much more. You simply go to dmemyvirtualdoctor.com and click Shop Now to browse the selection of durable medical equipment, or you can search by product category. At checkout, you will enter the ID code on your NeedyMeds drug discount card and click Apply Code. It's as easy as that. So the big question is, where can you get your NeedyMeds drug discount card? So let's transition back to the live website so I can show you just that. And as you probably guessed, there's a number of destinations on our website that will take you just there. First of all, under that Patient Savings tab, you will find a link to the NeedyMeds drug discount card on the top left side under that prescription assistance section, or on the bottom right side under additional resources. You will also find on the left-hand side a box with a red arrow that says Get Your NeedyMeds drug discount card, and they will all take you to the same page, the NeedyMeds drug discount card page. And here you can print out a downloadable PDF, cutting out this top section. You can scroll down and complete a form, being sure to choose a design. You can send us a self-addressed stamped envelope to our P.O. Box. And you can always reach out to our call center counselors at 1-800-503-6897. Do remember, we are in Massachusetts. We're on East Coast time. We're open Monday through Friday, 9 a.m. to 5 p.m., and we do have Spanish-speaking counselors. So let's return to that Get Your NeedyMeds drug discount card page, because there's something else I want to point out. So let's say you have your drug discount card. The next thing you're going to want to do is find out what pharmacies in your area accept the NeedyMeds drug discount card. And the chances are really good that there will be at least one, if not more, because the NeedyMeds drug discount card is accepted in more than 67,000 pharmacies nationwide. And as you saw, I just scrolled to the bottom of this NeedyMeds drug discount card page, and you'll see the pharmacy search. All you need to do is type in the zip code of where you're going to pick up your medication and see what pharmacies in the area do accept the NeedyMeds drug discount card. So let's see. I believe I typed in the wrong zip code, so I'm going to give that a try again. And again, you can do it more narrowly. You can type in, for example, your specific street address or your work address if you want to see what's really close to where you live. So let's try this again. So I'm just going to type in a zip code, and then you can choose whether or not you want pharmacies that are only in the zip code or a little bit further out if you have access to transportation. So that's a little bit better. So there are 27 pharmacies within 5 miles of the 80906 zip code. And hopefully you'll agree all the pertinent information is now on your screen. The name of the pharmacy, their contact information, including a phone number, and you can even click on map to see exactly where it's located. You can also print, using that print all hyperlink, the whole list of these pharmacies if you want to hang on to it or share it with a loved one, a neighbor, or a patient. So now let's say you have your drug discount card and you know what pharmacies in your area accept it. The next step would be finding out how much will this medication cost me using the drug discount card. And to do that, you simply click on the drug pricing calculator on the left-hand side. To find out how much the medication will cost you, you will need to know 4 pieces of information: the prescription name, the dosage, the day supply, meaning is the prescription for 30, 60, or 90 days, and the zip code where you would like to pick up the prescription. Couple of things I want to mention about this drug pricing tool. As I said in the beginning, drug prices do change from pharmacy to pharmacy and from month to month. So find out what the price is right before you're planning on going to pick it up. Don't find out what the price is and go and then plan on picking it up a couple of weeks later, because the chances are the price will change. Now, the other thing that I want to mention is that our drug pricing tool provides an estimate. Now, although the estimate is very close, it is not accurate down to the penny. So just a heads up about that. So that's all you would need to be able to use the NeedyMeds drug discount card. You've got the drug discount card, you know what pharmacies in your area accept it, and you know how much it's going to cost you before you head out the door. One thing I want to stress on the top right-hand side, as you saw I clicked on that before, is our call center counselors at 1-800-503-6897 can do this work for you. What I mean by that is they can mail you a drug discount card. They can tell you over the phone what pharmacies in your area accept the drug discount card, and they can let you know how much that medication is going to cost you. So don't hesitate to reach out to them if you do have some questions. So again, I do see some questions coming in, and this is just another reminder. Don't hesitate if you have any questions to type them into that question section of your GoToWebinar control panel, and I will do my best to get to all of them. So one other quick thing I want to point out, since we're talking about the drug discount card, on the left-hand side, you will also see a link for NeedyMeds Health Storylines. Health Storylines is a free self-care app that makes it easy for you to track and manage not only your health conditions, but the health conditions of your loved one. It also allows you easy access to the NeedyMeds drug discount card and other information and resources on assistance programs, and that's right at your fingertips. And again, you can download this app for free on Google Play or the App Store. Okay, so bear with me while I transition out of this website back to our PowerPoint. I do hope you found the information in today's presentation useful. We do encourage you to sign up for our upcoming webinars, and you can do so on the bottom right hand of our homepage on our calendar events. We hope you join us for that upcoming Health Storylines brief. It's a less than half-hour webinar on how to make the most out of that Health Storylines app that we just discussed. So we do hope you take advantage of that. And as promised, I wanted to leave up contact information. I did put my colleague Alana's email up there. If you are interested in ordering a bulk supply of drug discount cards or any of our educational brochures, please drop her an email. If you have any questions regarding this webinar, you can reach out to me at carla@needymeds.org. And once again, there's our toll-free helpline at 1-800-503-6897. And I'm going to go ahead and leave that contact information up while I get to some of the questions coming in. So we have a specific question on how someone would go about getting a service dog vest or contact by phone. So information such as that, what you're going to want to do, my recommendation is under that patient savings tab, go ahead and check out what's available by diagnosis under that diagnosis based assistance program section. And again, if you let your mouse hover over that patient savings tab in the center section, you'll see a hyperlink for diagnosis based assistance programs. Once you click on that, you'll be able to do a search by diagnosis, and then that easy A to Z index will pop up. And then in that alphabetized list, you'll find your diagnosis and see if there is access to a service dog or service dog vexed or something of that nature. The other thing I would recommend is giving our expert call center counselors a call, and they'll be able to assist you. Just remember, again, we are based in Massachusetts, so we're open 9 to 5, Monday through Friday, Eastern Standard Time. Another question coming in is, how does NeedyMeds support itself? So we get that question a lot. NeedyMeds basically relies on 6 sources of financial support. Like any other nonprofit, we do rely on corporate and individual donations, as well as grants. We do license our fees for organizations' use of our databases. We sell a software called PAP Tracker that helps clinics simplify the prescription assistance program application process. We do get a small fee every time the NeedyMeds drug discount card is used. We have thoroughly reviewed supporting partners on our website, and we do get fees from pharmaceutical companies for call center and application processing services. And you can find this information on the NeedyMeds website under the About Us tab on that navigation bar. Oh, here's a great question. You mentioned that you can use the drug discount card to save on pet meds. How? Actually, I'm happy to let you know we put together a less than 10-minute video on how to use the NeedyMeds drug discount card to save on your pet meds. You can go to that NeedyMeds YouTube channel that I pointed out at the beginning of the presentation. Again, you can find the icon, which is a hyperlink to the YouTube channel on the top right of our homepage with the rest of those social media icons. And once you get to that YouTube channel, you can type the word pets into the search bar. Or you can email me at carla@needymeds.org or shoot me a message in that question section, and I will happily send you the link to that video. So one other thing that I'm checking out. Oh, that's a great question. One of our participants checked out that noticed that I had up there that the health storylines webinar is, I have it up there on the wrong date. I have it up there for August 14th, but it's actually coming up on August 27th. Thanks for the heads up about that. And again, you can find more information about that webinar or other upcoming webinars on the bottom right hand of our homepage on that calendar of events. And again, look for that upcoming health storylines webinar. It's less than a half hour, and it'll really teach you everything you need to know about that app. Thank you so much for pointing out that I had the wrong date up there. So I hope you can join us for that. So another question coming in. Oh, here's a great question. We get this question a lot. Can people with Medicare Part D apply to prescription assistance programs? And I hate this answer, but the answer is simply that it depends on the program. Some will let you apply. Others will determine that on a case-by-case basis. The good thing is, though, you will see the answer to that in the eligibility section of the prescription assistance program listing on our website. You may remember that when we were going through what those prescription assistance program listings looked like, there was that whole eligibility section. When we reviewed it, we talked about 3 of those criteria at length: income, residency requirements, and insurance status. But you will also see on there whether or not you are eligible if you have Medicare Part D. So be sure to check that out, and don't hesitate to call the phone number on the program listed if you have any questions. So here's another great question is why are so many programs not available for people with Medicare Part D? Many people get in the donut hole every year and have very high copays. So that's a really good question. What I certainly agree with that. What I will say is two quick things. One is, well, actually three things. One, don't make the assumption that you automatically won't be qualified. Oftentimes, you're right that a lot of programs are not available for people with Medicare Part D. But as we saw earlier in the prescription assistance programs, that's not always the case. So it's definitely worth checking out our website. The other thing is I would stress calling our our expert call center counselors. The reason is that they really can come up with some creative ways to help you afford those medications. So don't just go to our website and find out that you're not eligible and then just not come back. Give us a call and see if there's something that we can help you with. And also, don't hesitate to check back the website regularly to see if the program has changed. The other thing is don't forget that we do have the NeedyMeds drug discount card that can help you to save on medications or prescriptions if you're not eligible for other programs. But here's one thing I want to stress. If you are trying to get out of the donut hole and it's the beginning of the year, don't use the NeedyMeds drug discount card to save because the money you use using that drug discount card is not going to count towards getting you out of that donut hole for Medicare Part D. So if it's in the beginning of the year and you have a chance of getting out of that donut hole, don't use the drug discount card to save. But let's say it's the very end of the year, it's November or December, and you're not going to get out of that donut hole anyway, you might as well use the NeedyMeds drug discount card to save on your prescriptions or medications because you're not going to get out of that donut hole anyway. So do keep that in mind, and I hope that helps. So what else am I missing? I think we've gotten to most of the questions. Again, if I didn't have the chance to answer your question, I will happily follow up with you via email, but don't hesitate to call our experts at the call center counselor at 1-800-503-6897. Thanks so much for taking the time to join us today and have a great rest of the afternoon. Take care.